As a parent, you want your children and teens to grow up to live long, healthy lives. Healthy People 2020, a national set of health objectives, shares a similar vision, which is to create a society in which all people live long, healthy lives. My name is Betty Orrell, and I'm a certified dental assistant and a dental hygienist. In this presentation, I will be focusing on the oral health section of Healthy People 2020, especially as it relates to children and teens and how you as a parent can help your children and teens achieve oral health. According to the Healthy People 2020 website, oral health is an essential part of staying healthy. The first three main points of the presentation are related to the Healthy People 2020 oral health objectives, including the need to decrease the number of children and teens that experience cavities, increase the number of children and teens that have sealants placed on their teeth, and decrease the number of children and teens that have untreated cavities. The final point emphasizes the relationship between oral health and overall health. At the end of this presentation, you should be able to discuss these objectives. You will also be able to discuss the role oral health plays in overall health. Before discussing the objectives and how to attain those goals, it is important to understand what cavities are and what causes them. A cavity is a disease of the tooth. It causes soft spots and holes on the teeth, which can lead to pain and facial swelling if left untreated. Cavities are caused by bacteria that produce acids. When your child or teen eats a sugary snack, the bacteria use the sugar as food, which causes the acid formation, resulting in a cavity. Now that you know what cavities are, their symptoms, and what causes them, I will discuss some methods to aid in achieving the Healthy People 2020 goal to decrease the number of children and teens that experience cavities. Cavities can be prevented by proper brushing and flossing. If your child is an infant, you can use a soft, damp cloth to wash the teeth. Young children need help with this activity because their manual dexterity is not fully developed, and teens may need reminders to brush and floss. Fluoride strengthens teeth and can be found in some drinking water, toothpastes, and mouth rinses. Next, consider a proper diet that is low in sugary snacks and beverages. Remember, sugar is food for the bacteria that cause cavities. Another preventive measure is the placement of sealants. The fact that sealants can prevent cavities is the reason for the next Healthy People objective, which is to increase the number of children and teens that have sealants placed on their teeth. A sealant is a plastic-like covering that is placed over the grooves on a tooth. The purpose of the sealant is to protect the grooves from bacteria and acids, which decreases the chance of getting a cavity. According to a Morbidity and Mortality Weekly report, a 60% decrease in cavities on the chewing surfaces of teeth was documented when sealants were placed. This indicates that sealant placement is an important preventive measure. Although preventing cavities is the best strategy, cavities can still occur. That leads me to the next objective, which is to decrease the number of children and teens that have untreated cavities. First, it's important to know if your child or teen has any cavities. Cavities are diagnosed by a dentist during a routine dental exam. It is important to treat cavities because if they are left untreated, they become larger and can cause pain and facial swelling. Treating a cavity requires the dentist to remove the decayed area of the tooth and place a filling into the hole created by the cavity. This process removes the disease and stops the cavity from progressing. I mentioned earlier that Healthy People 2020 has a vision of creating a society in which all people live long, healthy lives. So what is the connection between your child's healthy or unhealthy teeth and their overall health? Healthy teeth are needed for chewing food, speaking clearly, and having a pretty smile. Your child's ability to properly chew food is important to their growth and development. Food must be adequately chewed to be properly digested and allow vital nutrients to be absorbed by the body. Speaking clearly is important to their ability to communicate with others, which is related to learning, self-esteem, and emotional health. Also, having a pretty smile is important to their appearance, self-esteem, and emotional health. In conclusion, I have talked about how you as a parent can help your children and teens experience oral health. This is accomplished by not developing cavities, using preventive measures such as sealants, and prompt treatment of cavities if they occur. Remember, oral health is important to the overall health of your children and teens. After all, Healthy People 2020 and you as a parent want your children and teens to grow up to live long, healthy lives.